In recent years, the treatment for chronic lymphocytic leukemia has really revolutionized the treatment of patients of high-risk disease. Patients that a few years ago we knew that won't have any good outcomes after chemotherapy has completely changed. And today, this unmet need in this high-risk patient has been achieved by the introduction of BTK inhibitors, in this case ibrutinib, and the use of ibrutinib in the front line, mainly in the 17p deletion, who really has changed very likely the natural history of this patient. However, it's important to emphasize that today we do not have a frontline trial of ibrutinib in 17p. Rather, we know that this drug works very effectively in this patient. However, we still need to have a long-term follow-up to see what's happened in the long run with patients with high risk. But in general, I will say that the previous unmet need in high-risk patients has really changed with the introduction of BCR inhibitor, in this case ibrutinib, and they're going to continue to be changed with the combinations such as ibrutinib venetoclax or even monoclonal antibody venetoclax combination, and this in the future may represent a better or even a more successful frontline therapy for the treatment of high risk or even standard risk chronic lymphocytic leukemia patients. With all the excitement of the new drugs that are being introduced for the treatment of frontline or second line chronic lymphocytic leukemia, the future is quite bright, and right now all the research efforts are concentrated to really look for the best combination, the more efficacious but less toxic combination that can really reach very deep levels of response as MRD or minimal residual negativity in the bone marrow, which has been shown many years ago that can produce very long progression-free survival, and even in some cases, and it's still somewhat a dream to be reached in the next year, the possible cure of certain proportion of patients with chronic lymphocytic leukemia. So in the future, through the introduction of new therapeutic interventions such as target therapies with BCR inhibitor or BCL2 inhibitor, and maybe even in the future with the dissemination of CAR T-cell technologies for the treatment of CLL that right now is still very limited clinical trials, may really open the possibility and the probability that we may one day cure this condition.